morning and welcome to this year's Department of Medicine Awards Day. I am Jenny Olgis. I'm the Program Director for Internal Medicine. I want to welcome all of you. I also want to give Dr. Williams regards. He is out of the country right now, but he is thrilled with this past year and wanted me to just send his congratulations to all of our graduates and all of our award winners today. So at the close of each academic year, we gather to celebrate the incredible achievements of our learners and our educators. And it's a moment to reflect on the heart of our mission as an academic department of medicine, which is education. This is what sets us apart from all other clinical settings and industry. And it's what drives our shared commitment to shaping the next generation of physicians. So as Program Director of the Internal Medicine Residency Program, I am honored to serve as the Master of Ceremonies for today's event. This year's celebration is particularly meaningful because we are recognizing graduates who have completed their medical training not only with excellence, but with extraordinary perseverance. Our internal medicine resident graduates were just entering their second year of medical school when the world shut down in 2020. The COVID pandemic has shaped their clinical journeys in profound and lasting ways, and the same holds true for our fellows. And so despite these challenges, our trainees have shown remarkable adaptability, strength, and resilience, and these are qualities that will serve them and their patients well for years to come. I want to extend my deepest thanks to my program staff who have done all of the heavy lifting and behind the scenes for today's event. Their dedication and hard work make all of this look effortless, and I am so grateful to their support. And finally, to our faculty, thank you. Your mentorship, teaching, and thoughtful evaluation of our trainees is essential to everything that we do. The success of our programs is a direct reflection of your tireless commitment to excellence in medical education. We deeply value your time, your energy, and the passion that you bring to your work, and we could not do this without you. So on to the awards. Our first award is the Forrest Arnold Award for Grand Round Attendance, given by the department for the faculty member and the resident who have the highest attendance at Department of Medicine Grand Rounds. And it's named for Dr. Arnold because for years, Dr. Arnold was the winner of this award. And so we decided to name it after him. So this year, we actually have a four-way tie for faculty. And so, and I think, do we have awards for them? Okay, so if you hear your name, please come up and be recognized. So our four faculty winners are Dr. David Armstrong, Dr. Ashutosh Barve, Dr. Satya Krishnasamy, and Dr. Husam Sarafi. And our resident winner is Dr. Nicholas Heyman. So you will actually be receiving an email because Dr. Williams wanted to give a little incentive for folks to be sure to come to Grand Rounds. And so he has a little award for each of you. And so we will email you with the details about that. We will now present the awards that are given by the Internal Medicine Training Program. So first, oh, you know what? I think I can't, it's hard for me to drive and talk at the same time. So you can see the winners. Okay, so the In-Training Exam Awards, it recognizes the residents who achieve the highest scores in their class on our internal medicine training exam. We also recognize the residents who have the most substantial growth from the previous year. And so the PGY1 with the highest ITE score was Roark Swank. The PGY2 with the highest ITE score was Emily Converse. The PGY2 with the highest improvement in their score was Kush Patel. The resident with the PGY3 resident with the highest score was Adam Hain. Come on up, Adam. Come on up. It's because he's always at Grand Rounds. And the PGY3 with the most improved score is Zach Hagemeyer. So congratulations to all of you. Our next set of awards are the Residency Program's Excellence in Teaching Awards. These are awards that go to the division, the faculty member, and the fellow who are chosen by the internal medicine residents for demonstrating excellence in teaching. First, I am excited and proud to announce that the residents have chosen to honor the Division of General Internal Medicine for excellence in teaching. So Dr. Smith, if you will come up. Next, we have the faculty member chosen by the residents for excellence in teaching. And this year we have a tie. So I am proud to announce that congratulations to Dr. Rodrigo Cavalazzi and Dr. Rice for their commitment in educating our residents. Come on. Lastly, we want to recognize the fellow who is chosen for the award for excellence in teaching. And congratulations and thank you goes to Dr. Sarah Katubadine, sorry, from the Pulmonary and Critical Care Medicine Department. We will now recognize a few of our residents for their outstanding work. The award for the most professional resident is chosen by the house staff for the resident who most consistently demonstrates professionalism, and this year's award goes to Emily Hartman. The second award, the interns are asked to select the PGY2 resident who best exemplifies excellence in teaching, and that award goes to Dr. Emily Converse. And the third award is for outstanding senior resident who is also chosen by the house staff, and it's given to the resident who best exemplifies leadership, teaching, and excellent clinical skills. And I'm delighted to present this award to Dr. Adam Hain. I would now like to thank our chief medical residents. This was an extraordinary year. We were down to 2 chief residents this year, and then one is out on maternity leave. And so it has been a challenge, but they have risen to it. And so best wishes and sincere gratitude go to Esther Bach, who is entering rheumatology fellowship at the University of North Carolina in Chapel Hill, and Joey Abear, who will be a pulmonary and critical care fellow at the University of Pittsburgh Medical Center. Thank you. Congratulations to both of them. I want to take an opportunity to express my gratitude for the four associate program directors for internal medicine, Dr. Caitlin Gordon, Dr. Justin Kingery, Dr. Nishant Patel, and Dr. Clayton Smith. They have been an outstanding team to work with this year, and my enormous gratitude to all of you for making this year a success. And I especially want to just recognize Dr. Smith. I'm sad to announce that he is officially stepping down as Associate Program Director at the end of June after a very long and illustrious career as an APD. Although he is still going to be here, he's going to continue to be our division chief for general internal medicine. He's going to continue to work with our residents in clinic and maybe ever so often on the hospital wards. But we are grateful for your many years of service to the program. We're thankful that our residents will get to continue to learn from you. So thank you. So it's now time to recognize our residents who will be leaving us this year. And first, I want to give thanks to our preliminary interns who have worked tirelessly to give our patients excellent care and learn as much internal medicine as possible before moving on to their advanced programs. To Joseph, Julia, Bobby, Jess, Ridima, Jacob, Alex, Trey, Jeffrey, Matthew, Caitlin, Maddie, Colton, Mark, Monica, and Andrew, we wish you the very best as you continue on in your respective residency programs. And now it is time to recognize our graduating internal medicine residents. I will announce each of them, and the slide indicates what their next stages of their career are, whether it's fellowship or employment and where they're going. I'm proud to see where each of them ends up long-term and see what their future successes hold. Please hold your applause until the end, and I would invite all of the graduates as I call your name to come up and we will take a picture. And our graduates are Shiro Aromawara, Deepti Athavali, Eric Chung, Christina Quixote, Pavan Daga, Anjali Dubaka, come on up, Sloan Goldberg, Zach Hagemeyer, Emily Hartman, Nicholas Heyman, Adam Hain, Danielle Gianti, Danielle Kem, David Liu, Stuart Orange, Nicholas Poblados, Aaron Rotier, Ziad Smiley, Ashwarya Thakur Desai, Harsh Tiwari, Hannah Whalen, and Brandon Wilkins. Congratulations, class of 2025. Thank you. And now I'm going to invite Dr. Workman to come up and recognize the graduates of our MedPeds residency program.
Good morning. I would also like to congratulate our graduates for 2025. I'm not sure any of them are here. I think several of them are on PEDS this morning, but I would like to congratulate them. We have Lucas Banter, Allison Etling, Shelby Mashinsky, Jim Stanton and Jared Young. We'll give a hand of applause for them.
So in addition to recognizing our resident and fellow graduates today, we also have some faculty graduates that we want to announce. And so I invite Dr. Cook to come to the stage to share a little bit about the Medical Educators Academy and its first class of graduates.
Thank you, Dr. Olges. So this year we have a very special new group of faculty to honor. Over the past academic year, these faculty voluntarily took part in a brand new intensive faculty development program, the Department of Medicine's Academy of Medical Educators. Each one of the clinician educators presented today completed the entire program and will be inducted into the Academy. Their efforts represent a total of 165 faculty hours of development. And special thanks goes to Dr. Olges, Dr. Brown, and Dr. Gordon for serving with me as faculty development presenters. As my clinic residents are aware, I like to celebrate moments of excellence by bestowing gold stars. In addition to receiving a certificate today, each of these faculty members will receive a gold star pin for their white coat or jacket. Residents, when you see the gold star, you will know that it means that this faculty member went above and beyond to dedicate themselves to being the best educator possible. Please come forward as your name is called. Mohammed Aldas. We'll hold applause till the end. David Armstrong, Forrest Arnold, Ryan Baylor, Esther Bach, Juliana Brown, Camila Chisak, Yvette Kua, Ryan Doster, Shahab Gafgazi, Caitlin Gordon, Scott Hannon, Jordan Hendrickson, Ryan Kaufman, Getz Clucker, Satya Krishnasamy, Jasant Madampuram, Jenny Olges, Nishant Patel, Hussam Sarakbi, Vivek Sharma, Clayton Smith, and Alka Tiagi. Let's give them a huge round of applause. And before I go join the picture, I just want to say I'll be recruiting very soon for the next cohort of the Academy. So faculty, please watch your email and consider joining us this next year.
So I'm going to invite Dr. Smith to come back up to the stage to represent the Department of General Internal Medicine.
Good morning, everybody. It's my pleasure to introduce today's awards for the Division of General Internal Medicine. These are awards that are voted on by our residents to honor the best teachers in both the hospital and the ambulatory settings. So the recipient of our first award, Best Teacher of Hospital Medicine, is a master class in medical education. They are efficient, caring, supportive, and always up to date on the very latest medical literature. Those who work with them feel that they always respect their time and appreciate that they are able to provide constructive feedback. They are an attending that everyone in our program should be lucky enough to work with once during their training. Please join me in congratulating our now 7-time award winner, Dr. Tyler Sharp. And now we'll move on to our award for Outstanding Teacher in the Ambulatory Setting. I'm particularly happy to announce this year's award winner. A resident recently told me that they may be in their first years in attending, but they carry the clinical insight and composure of someone far more seasoned. Their depth of knowledge, sound clinical reasoning, and thoughtful approach to patient care are truly impressive. It's clear that patients trust them and their colleagues admire them, not just for their medical acumen, but for the truly good person they are. Having worked alongside them now for the last year, I'm not sure I could have said any better myself. Please join me in recognizing Dr. Ryan Baylor as the
I now invite Dr. Lally to come up and present the Palliative Medicine Fellows.
Hi, everyone. I'm Drew Lally. I'm the Palliative Medicine Program Director. I took over for Dr. Pate starting at the beginning of this year. And I want to say it's been a great transition this year with two very talented fellows. I've been very thankful to work for them. So our first fellow, Dr. Shalini Chabra, who will be sticking around to do the Oncology Fellowship this next year here at the University of Louisville. You can come on up, Shalini. And our other fellow, Dr. Ashley Isles, who will also be sticking around with us, thankfully, and be able to stay as a associate professor at the University of Louisville in our program here, and the medical director at Jewish Hospital for the palliative medicine program.
Take a picture. Okay, next, I want to invite both Dr. Skepgazi and Dr. Ikram to come up and present the Cardiology and Interventional Cardiology Fellows.
You have more, so go ahead.
Good morning, everyone. So as you can see, we graduated a big group of fellows this year. We have figured out a way. Eventually, we've in fact equalized our classes. So as of next year, we're going to have 7 fellows per year. This took us 3 years and a lot of help from the department as well as the GME office. But on to our graduates this year, we have Dr. Afifi, who's going to stay with us for another year for interventional fellowship. And Dr. Eladili, who is also a graduate, in fact, of our own internal medicine program, who is now doing an extra year, so doing 7 years of postgraduate training at the University of Louisville. We have Dr. Bhattacharya, who's going to clinical electrophysiology fellowship at MUSC, Charleston, South Carolina. Dr. Bricknell is going to practice at Nashville General Hospital, at Nashville, obviously. Dr. Jaw is going to stay in town across the river at Baptist Health, Indiana. Dr. Khan is going to do an extra year of advanced cardiac fellowship at Portland at University of Oregon. Dr. Ishan Parikh, another graduate, in fact, of our own internal medicine program, who is joining our faculty here next year, and we're excited to have him. Dr. Popriva, another one of our internal candidates who is joining, in fact, UofL on the CMG side for cardiology. And finally, Dr. Joshua Salabi, who is joined Baptist Hardin as a non-invasive cardiologist.
Thank you, Shahab, and everyone in the auditorium today, and my congratulations to the class of 2025. I've had a personal pleasure of working with many of you, and it has been a wonderful privilege. So I have 2 fellows. I don't know if you have.
They may not have made it up there.
Okay, anyways, so we have almost 30 years of an interventional program now going on. And every year I'm surprised at how the group has superseded the previous group. And interventional cardiology, they are already trained physicians, thanks to many of you guys, and then 3 years of fellowship. So they're already at a PGY 7 level. And then it's the procedures that I called both of them this morning. They were signing up patients for the procedures this morning. So just to graduate from cardiology fellow as a non-invasive cardiology, you need 100 procedures. And you have to, if you want to do invasive cardiology, not interventional, you have to do another 200, so make about 300 procedures. If you have to be an interventional fellow, you have to do another 250 interventions. So you have, another 500, so total of 550. Just to give you a perspective how busy our program is, our fellows, they graduate with 500 procedures as a general fellow. And in their training as interventional, they do another about 800 to 1,000 procedures. So this year, likewise, our 2 fellows, Dr. Hassan Saleh, you must have seen, many of you have seen him. He is going to Cornell for advanced complex intervention fellowship another year. And Dr. Amit Raut, who was our he was our fellow here, and he is joining the community medical group here in town, so he'll be around. So they are both outstanding fellows, and it has been a wonderful, to work with both of them. So, congratulations to both of them.
I'm now going to invite Dr. Krishnasamy to return to the stage to present the endocrinology fellows.
Thank you, Dr. August. Congrats to everybody, residents, fellows, and also the faculty from MedEd Academy. And I wanted to thank the academic leadership, Dr. August and Dr. Cook and Dr. Williams, and also our chief, Dr. Mokshigandam, our wonderful faculty, and also Kelly Gallier and Laura Holfield, who are here. Couldn't be possible to do what we do without everyone's help. So wanted to introduce Dr. Al-Rubai. He's our one of the graduates. He's from Atlanta area. That's where the family is. So, and then he's moving back to Atlanta to join the rest of the family. And congrats to you. And something unique about Dr. Al-Rubai is he does fabulous presentations. And his final senior research presentation was yesterday. It's on YouTube, so you guys can get to watch it. So, and Dr. Zaidi is our other fellow who's graduating this year too. And both of them did really well. And also, she also did a presentation, and I think Dr. Kingery and some others were there. It's on Suboxone and adrenal insufficiency. She did an excellent job, and she's going to be staying in the community. Congrats to both of our graduates.
Next, we have nephrology, and I believe Dr. Raj is going to come up.
There's a concept in medicine, and I think all the residents and fellows know, it's called a black cloud and white cloud. And I think Sammy was the whitest cloud I've ever met in my life. Because every time he came on, the list would be so small, I had to go outside Jewish hospital and try to see, anyone have kidney disease, please come in, please come in. And as soon as he left the service, you'd get all these hyponatremias, and he would call me like, what is going on? So Sammy is going to be graduating. He's going to be joining NAK, a private practice group. He's an excellent fellow. He's going to do wonders. He's so compassionate. And I think NAK should be super proud to have him.
Okay, next we have GI. I think Dr. Rogers is going to come up.
Starting off right. So I'm a new face for many of you. I want to say a special thank you to the division for supporting me in the transition. And also, he's not going to be here to say it, but thank you to Depender Pair Julie. He spent 12 years in this role and really handed me a program that was ready to go and in top shape. And so I would like to thank him as well if we could. I really appreciate everything he's doing. Laura has been very helpful as well. I know she's been thanked, but I want to thank you, Laura, too. And you know, all of my colleagues have really been very supportive. So thank you as well. I want to say thank you to Dr. Stephen Eds in particular as well. He was our chief fellow. He handled a lot of the grunt work. So thank you for that. But also, if you guys don't know, the gastroenterology fellowship is very fellow driven. So all of the fellows had you know, some role. And I think I'll keep it short and sweet and just say that it is no exaggeration to say that I learned more from the fellows than they learned from me. And so I really appreciate everything you guys did over the past 3 years for us. So Dr. Stephen Eds is going to be joining a practice in Owensboro Health. That's where he's from. So he's going to go back and serve his community. Dylan Gerlach is going to be at Gastroenterology Health Partners, which is a group here in town. Dr. Litzenberg will be in Cincinnati, so the northern Kentucky, Cincinnati area with Tri-State Gastroenterology. Pratik Mathur is staying here with us. He's going to be an assistant professor, actually in the same subdivision of our division. So I'll be seeing plenty of him. And Dr. Lucia Rivera will be here in Louisville practicing gastroenterology as well. So thank you guys very much for everything.
I would like to invite Dr. Arnold to come back up to the stage and present the infectious disease division.
Thank you. On behalf of Dr. Hannon and Dr. Thomas, I have the distinct pleasure of introducing the graduate to the best subspecialty infectious diseases. No offense to you other program directors. Post-COVID, it was rather difficult to find fellows. In the United States, there were more slots for infectious diseases post-COVID than there were people. So we sought international. And so one of our requirements is to find somebody who is excellent, but that's very difficult to do in a short Zoom call, you know, when it's 2 o'clock in the morning their time and they're trying to look awake. And we found a real diamond in the rough with Zarak Khan. Now he's coming here as a infectious disease fellow. He finishes and he has definitely made every requirement and just has been an excellent fellow. Now he is going to go to internal medicine residency in Rochester, New York. And many of you might be thinking, well, that's backwards. But to him, it's a path forward. But the American Board of Internal Medicine would not allow him to sit for boards right now because his internal medicine was in Pakistan. So he did that for 3 years and now he's going to go to New York. So he's superseded all that and compromised and is going back for 3 more years of training. He's going to do well. And in 10 years, I know he's going to be I'm looking forward to see what he will do. There'll be a resident come to him one day and he'll say, come on in, sit down. He'll have a big, huge office. And the resident will say, I'm working too much. And Dr. Khan will say, how would you like to do this twice? Now get back to work and put a tie on, look like a doctor. So without further ado, please come forward, Dr. Zarak Rashid Khan.
I invite Dr. Cloker to come forward and present the HEMONC Fellows.
Good morning. I would argue with you that hematology oncology is much more interesting than I. And it's quite a challenge to be double board eligible after 3 years. An enormous amount of knowledge and data. Our guidelines have expanded over the last 10 years from 100 pages to 800 pages, and they're all fine print and look like a New York subway system, very complicated in the algorithm. So we have 3 who graduate in hematology and oncology. Walid Bahash already did a fellowship in Cleveland on acute leukemia and won numerous awards with the American Society of Hematology on molecular biology of ALL. He will do bone marrow transplant. And they don't call it bone marrow anymore. They would like to call it cellular therapy because now we get the cells out of the peripheral blood, not the bone marrow. And he's going to transplant patients in Indianapolis, the Franciscan Health Institute. Pranali has also been an exceptional fellow, chief fellow. She scored almost perfect on all the tests. She will be an assistant professor at Charleston University. And we hope we get her back after she gets her J1 waiver and all that situated. Caio already had been an oncologist for many years in Brazil. Worked at the University in Rio de Janeiro, had his own private practice, and will go and practice in Massachusetts, also in a private practice. I'm a little bit embarrassed about the role. As a program director, you're supposed to teach, so to be awarded for this a little bit embarrassing, but I must say, made me very proud and gave me a lot of joy. So thank you very much.
I'm going to invite Dr. Rubes Perez to come up and present the Pulmonary Critical Care Fellows.
Good morning, everyone. Congratulations to everyone today. I'm very tempted to make a comment about pulmonary critical care being the best fellowship, but I could not think of anything funny, so sorry. So I'm very, it's a pleasure for me to introduce my current senior fellows. They're a very hardworking clients. They take care of the sickest patients here at Jewish, and they took on the responsibility of covering nighttime here and being available for the residents and supervising them and helping them with the education. So Dr. Joy Wine, she's our current chief fellow. She did residency at Wright State, and she's going to be doing sleep fellowship at University of Illinois. Dr. Hassim Rambar, he did residency here. I don't think he's here. I don't know if I see him. There he is. He's going to stay in town, do private practice at home in Brownsboro. Dr. Brown did residency at the University of Iowa, and she's going to be going back close to home or at home in Indianapolis. And Dr. Joe Angileri did a residency at the UK. Is going to go to the state, the up north state to practice at McLaren. So congrats, everyone.
I think come on up so you can get a picture. And then, and last we have sleep medicine and have Dr. Bobby come up.
Well, I wanted to say that it has been an absolute pleasure working with and introduce Dr. Nicole Todd. She was here at internal medicine residency, a family practice residency, and she has taught me so much more than I've taught her this year. And I wanted to thank her very much for being part of our program. And she is going, unfortunately, back to Calgary, Alberta, Canada, but we hope to see her back really soon. Please come up, Dr. Todd.
Excellent. And I just want us to give one more big round of applause for all of our graduating residents and fellows for your hard work, and best of luck in all of your endeavors in the future. That concludes today's award ceremony. Congratulations again to everyone. And this also concludes this season of Department of Medicine Grand Rounds. We will take a summer vacation and we will resume back in September. So we will see you all the first part of September. Thank you.
September 4th.
September 4th.